Varicose veins gone without surgery, the step-by-step plan. Right now, as you're sitting or standing there reading this, the blood in your legs is losing a quiet fight with gravity. Think about it for a second. Every drop of blood that's gone down into your feet has to climb all the way back up to your heart, against the pull of the earth, with no pump down there to push it. And for a lot of people watching this, that journey back up is already failing. Tiny one-way gates inside your veins are starting to leak. Blood is pooling, pressure is climbing, and it's doing all of this silently for years, long before you ever see a single twisted vein on the surface. Here's the part most people get wrong. They think varicose veins are a cosmetic problem, something to be a little embarrassed about, maybe cover up at the beach, but basically harmless. And by the time anyone takes them seriously, the pressure has already been damaging the leg for a decade. I've seen where that road ends, and it's not pretty. But here's the good news I really want you to hold on to from the start. For the vast majority of people, you do not need surgery to get control of this. You really don't. There's a step-by-step plan, and it works with your body's own plumbing instead of against it. Hi, I'm Dr. James Whitfield. I'm an emergency medicine physician. I've spent just over a decade in the ER, and in that time I've treated more than 40,000 patients. And the reason I make these videos is simple. I got tired of meeting people in the emergency department after the damage was done, when so much of it had been building quietly for years and could have been caught. My whole mission with this channel is to keep you out of my ER in the first place, to help you prevent disease before it ever starts, and live longer, stronger, and more independent. So here's exactly what we're going to cover today. First, I'll show you how the veins in your legs are actually supposed to work, because once you see it, everything else clicks into place. Then I'll show you the real mechanism behind varicose veins, the thing most people, and honestly even some doctors, completely skip over. We'll name the true villain here, and it's not the vein you can see. And then I'll flip the whole thing around and give you the step-by-step plan to take the pressure off, relieve the aching and heaviness, slow this down, and in a lot of cases stop it from ever needing a procedure at all. I'll give you a practical framework you can start today. Now before we get into it, I want to ask you one small thing. If you find this helpful, please consider subscribing. I promise to keep making the most useful, honest videos I possibly can. And if you get to the end of this one and you haven't learned something genuinely new, feel free to unsubscribe. No hard feelings at all. The thing is, only about a quarter of the people who watch these videos have actually subscribed, and subscribing is what helps this channel reach more people like you who could really use this. So please, 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 if you can, hit that button. It honestly makes a bigger difference than you'd think. Okay, let's start with how this is all supposed to work, because it's beautifully simple when you think about it. Your arteries are the easy part. Your heart is a powerful pump, and it fires blood out under high pressure to every corner of your body, including all the way down to your toes. Gravity actually helps it on the way down. The hard part is the return trip. Once the blood has done its job in your legs, it has to come back up to the heart through your veins. And your veins have almost no pressure of their own. So how on earth does blood travel uphill, from your ankles back up to your chest, all day, every single day? Two things make it happen, and I want you to remember both of them, because they're the heroes of this whole story. The first is your calf muscle. Now, this is one of my favorite facts in all of medicine. Your calf is basically a second heart. When you walk, when you flex your ankle, when you stand up on your toes, your calf muscles squeeze the deep veins running through them, and they pump blood upward, back toward your heart. That's why it's called the peripheral heart, or the second heart. When your calf is working, your blood moves. When your calf is still, your blood stops moving. Hold that thought, because it's going to matter enormously. The second hero is a set of tiny one-way valves inside your veins. Picture little floodgates spaced all the way up the vein. When the calf pumps blood upward, the gate opens and lets it pass. Then, the instant the blood tries to fall back down under gravity, the gate snaps shut and stops it. Open going up, sealed going down. So the blood can only ever travel one direction, toward the heart, one section at a time, like a series of locks on a canal. The calf provides the push and the valves stop the slide back. That's the system. That's how you defy gravity in your legs every single day without even thinking about it. Now, here's where it gets really interesting, and this is the part most people have genuinely never heard. Varicose veins are not really a problem with the vein wall going weak for no reason. They're a problem of pressure and failed valves. Let me walk you through the chain because cause and effect is everything here. It starts with one valve that stops sealing properly. Maybe it's genetics, and we'll come back to that. Maybe it's years of standing, maybe it's a pregnancy. Whatever the trigger, one little floodgate stops closing all the way. So now, when blood should be held up, some of it leaks backward and falls back down. We call that reflux. That reflux blood pools in the section below. And pooling blood means rising pressure in that part of the vein. And here's the cruel twist. That extra pressure stretches the vein wall a little wider. And when the wall stretches wider, it pulls the edges of the next valve down the line apart so that one can't seal anymore either. So now you've got two failing valves. More backflow, more pooling, more pressure, more stretch, another valve gone. One failure creates the next. What you eventually see on the surface, that rope-like, bulging, bluish, twisting vein, is just the final visible result of months and years of rising pressure pushing the vein out of shape. By the time you can see it, the real story has been playing out underneath for a very long time, quietly, which is exactly the pattern I see with almost everything serious. So what's the trap? What flips a normal leg into this downward spiral? A huge piece of it is simply modern life. Both sitting still and standing still switch off your second heart. If your calf isn't contracting, that pump just stops, and the blood sits in your legs under pressure for hours at a time. Think about who's most at risk. People who stand all day, nurses, teachers, hairdressers, factory and retail workers, and people who sit all day at a desk. Then add the things you can't control as much. Genetics is the single biggest factor here, so if your mom or dad had them, your odds go up a lot. Pregnancy raises the pressure in the system and adds hormones that relax the vein walls, which is why so many women first notice veins during or after pregnancy. Carrying extra weight raises the pressure too. And it tends to get more common with age, simply because it's had more years to progress. Now let me name the true villain, because this is the whole point of today. The villain is not the cosmetic vein you can see. The villain is the sustained high pressure in the leg, what we call venous hypertension. That pressure is what does the real harm over time. Let me be really honest here, because I don't want to scare you, but I do want you to take this seriously. When that high pressure goes unmanaged for years, the leg starts to change. You get swelling that's worse by evening. You can get a brownish staining of the skin around the ankle, which is actually iron leaking out of the blood and staining the tissue. The skin can get hard and tight, and in the worst cases, you get a venous leg ulcer, an open wound near the ankle that just will not heal. I've lost count of how many of those I've seen, and almost every single one started years earlier as veins that somebody assumed were just cosmetic. So, no, this is not vanity. This is a slow pressure problem with a real finish line if you ignore it. But here's the beautiful part, and this is what I really want you to take away. Everything that fixes this uses the exact same system we just talked about, only in reverse. You restart the second heart, you bring the pressure down, and you support the walls. So let's get into the actual plan. Step 1. Wake up your second heart every 30 minutes. This is the single most important habit, and it's free. If you sit or stand still for long stretches, set a reminder. Every half hour or so, do 20 calf raises. Just go up on your toes and back down. Or pump your ankles up and down under the desk. Or take a 2-minute walk. Every time your calf contracts, you're physically pumping pooled blood out of your legs and dropping the pressure. You are doing the work those failing valves can't. Step 2. Walk every single day. A daily walk is basically a long, sustained session of your calf pump doing its job. Something in the range of 7,500 steps a day is a great target for most people. But honestly, more than you do now is the real goal. Walking is the closest thing there is to a treatment you can do for free, in your own shoes. Step 3. Use graduated compression stockings and use them properly. This is the one most people skip, and it's a shame because the evidence behind it is solid. Graduated means they're tightest at the ankle and gently looser as they go up, which physically squeezes the blood upward and stops it pooling. For most people, we're talking somewhere around 15 to 20 or 20 to 30 millimeters of mercury of pressure. Put them on first thing in the morning before the swelling builds and wear them through the day. One real caution: if you have diabetes or any problem with the arteries in your legs, talk to your doctor before wearing compression because the strength has to be right for you. Get properly fitted if you can. Step 4. Elevate your legs above your heart. Gravity caused this problem, so let's use gravity to undo some of it. Lie down and prop your legs up on a few pillows so your ankles are higher than your chest for about 15 minutes, a couple of times a day. Evening is perfect after you've been on your feet. You'll feel the heaviness drain right out. Step 5. Take the load off the system. This means keeping your weight in a healthy range because extra abdominal pressure pushes straight down on those leg veins. It also means not staying frozen in one position, sitting or standing, for hours. And here's one people never expect. Eat enough fiber and drink enough water to avoid straining and constipation, because all that straining spikes the pressure in your abdomen and down into your legs too. Step 6. Consider the evidence-backed extras and know your red flags. There's a plant extract called horse chestnut seed extract, and a Cochrane review, which is about as rigorous as evidence gets, found it can genuinely help with the aching, swelling, and heaviness of poor venous return. It's not a magic cure, and you should run it past your doctor first, especially if you're on other medications, but it's a real option. And please, learn the warning signs that mean stop managing at home and get seen. If you ever get sudden swelling and pain in one leg, that can be a clot, a deep vein thrombosis, and that's an urgent, same-day problem. If a vein starts bleeding, or you develop that brown skin staining or any open sore near the ankle, see a doctor. Those are the signals that the pressure has been winning and you need help. Now, let me be completely honest with you about expectations, because honesty is the whole point of this channel. This plan will not magically erase a big, rope-like vein that's already there. What it will do is take the pressure off, relieve the aching and the swelling and the heaviness, slow the whole thing down, and in a huge number of cases, stop it ever progressing to anything dangerous. And here's the reassuring bit. Even if you do eventually need a procedure, the old days of being put under and having veins surgically stripped out are largely behind us. What we have now are minimally invasive options, things like laser or radiofrequency ablation, foam treatments, even a medical glue, often done while you're awake, and you walk out the same day. So, in a very real sense, for almost everyone, this is fixable without surgery. That's not a sales pitch. That's just where the medicine is now. So let's zoom out for a second. Your legs are not a cosmetic accessory. They are the thing that's going to carry you up the stairs, out to the garden, and across the parking lot into your 70s, your 80s, and beyond. The pressure that decides how those decades go is being set right now, quietly, by what you do every single day. The healthcare system is brilliant in a crisis, but it almost never catches the slow stuff in time. That part is on you. And the wonderful thing is, the fix isn't some expensive secret. It's your own second heart, a pair of stockings, and 15 minutes with your feet up. It's beautifully simple when you actually understand it. If this helped you see your own body a little more clearly, do me a favor and hit subscribe, give this video a like, and pass it along to someone who's on their feet all day. It really does help this channel reach more people. Take care of those legs, and I'll see you in the next one.